Okay, so this is our discussion about patient-centered care. First question is, what does patient-centered care mean to you?
Well, to me, it is having a healthcare professional put the patient first and make them feel like they care, go an extra step to make sure they're comfortable and having a good experience while they're seeing you, and to make sure that you're not just going through the motions and doing your job, that you actually get to know the patient so you can maybe go the extra step to help them out.
Yeah, I agree. I think it's important to kind of, like, not just, like, one patient onto the next, like, just, like, saying, not just, like, this is what's going on with you, like, here's your results from, like, this or whatever, but, like, how are you feeling today? You know, just, like, taking a step further to actually, like, care, like, about the patient. Because, you know, you see some of those doctors that are just, like, in and out, like, they just want to get through the day.
I think it's really important, too, because of if the patient trusts you with, like, you, like, getting to their, like, not personal life, but, like, their feelings towards things, I think it makes them trust you, and you need that trust for, like, rehab, injury, so that if they go down, they feel comfortable with you testing and everything like that. They know you're not going to, like, just ship them off, say this is what it is, I'm just going to refer you or anything like that. So I think that's important.
Yeah, I think that's important, like what you said about, like with rehab and stuff, because I know, like, me personally, we had an athlete come in, and she didn't, like, necessarily, like, feel comfortable with us, like, saying something, so, like, she went to health services and kind of, like, hid it from us for a little bit. So I think, like, that's something, like, for, like, me and, like, the people I was working with that, like, we need to work on, just, like, they have, like, level of trust, like, because it was something kind of personal. Like, I think it's important to have that, like, with all your athletes, so, like, they can come to you, like, for anything.
And, like, what I've noticed, too, is with working our clinical rotations and building these relationships with the athlete, it goes outside of our clinical rotation, too. It's building good friendships to where they can trust me outside of clinical rotations as well. But because they have built that relationship outside of the practice of athletic training with us, they feel more confident in my ability as a clinician because they can trust me outside of work. It helps boost that trust in work as well.
Yeah, that's a good point.
And knowing that they trust you just builds more confidence in us.
Yeah, definitely.
And I think that is really important to have when we're evaluating or taping or anything like that. I think confidence is important. So for them to trust us and our abilities, that's like a really big part in athletic training, I think.
Yeah, that's a good point because, like, I think right now, like, one of the goals we all had was, like, talking about, like, our confidence. So, like, having an athlete, like, being, like, come to you specifically for stuff, because I know, like, I have an athlete that doesn't necessarily, like, come to me for things, and it makes me think about, like, oh, did I treat her wrong one time? Like, did I do this or do that? So I think it's really important. I think it helps the patient, but I think it also, like, helps us a lot, too, with that. Okay, the second question is, why is patient-centered care important?
It allows the patient to know you care. Like I said before, it allows the patient to know you care. You're not just going through the motion, just patient after patient. That you actually want to take the time to make sure they're getting the care they need, not just the care you want to give them. And it goes along with just the trust thing again.
Yeah, I think it's important, and like what you kind of said earlier about like an athlete or whoever, like a classmate, being able to come to you like outside things like, hey, this happened, like what do you think I should do? Like just to have like, instead of them like, you know, like they have someone else they can like come to and be like, hey, this is going on, like can you help me out with this, or like what should I do? I think that's really important with all that.
I think not having patient-centered care is like them not coming back. So like my chiropractor, we have a great relationship. He makes me feel really comfortable. So when I come in, like it makes me excited to come back. So if they didn't make you feel comfortable, or they didn't treat you the way you wanted to be treated, then I wouldn't really want to go back. So it's like not motivating as a patient.
It's kind of like what we learned in Principles Fitness today about exercise programs. This goes along the same lines. You want to keep them motivated. You want them to make them feel, what's the word? Make them feel worth it, I guess, kind of, to make their experience worth it. to where they want to come back and they don't just like, especially in the rehab clinic or an exercise program setting, you want them to keep coming back so they can get better and achieve their goals. If you're not there to motivate them and keep them on track, the turnover rate's really high. In 2-3 weeks they might drop out and quit. But with patient-centered care, it goes along with the motivation and holding them accountable and showing them that you care about their health and their well-being, not just their money that you may or may not get depending on what setting you're in. So it helps keeping patients coming back as well.
Yeah, I think like from my perspective, when I like had my first knee surgery, like I did a lot of like my rehab like on my own, and like seeing how like enthusiastic like the doctor was about things like made me wanted to work like that much harder. Like they were so much more like proud of like what I actually did, and I think that was like one of the biggest motivators of me like coming back to play so quickly, because my doctor was like, you know, like they were on my team, like they were encouraging me. And I think like even like with our kids, like when we do rehab, like some are like, oh, like we have to do rehab, like some of them come in like, yes, like I get to do rehab today. And I think like that's a huge difference in like how they play, like how they do everything. I just think that's a big factor behind all of it.
Those are the best people to work with too, are the people that want to do it and actually want to break a sweat and actually care about getting back. And you need those people that are like self-motivated and they just don't need like someone pushing them all the time, because when they're self-motivated, it just makes it that much easier to be motivated towards them.
Yeah. What opportunities does this bring to athletic training? I think kind of we've been talking about like I think it opens doors to have relationships outside of just the AT room. I think it like helps us like maybe like we help a kid out and like then their family is like, hey, like this person's awesome. And then like what if that person's like at a job we see like down the road? Like I think like I feel like that's like a big.
I mean, especially with you always hear the saying, "Oh, it's a small world."
Yeah.
Like, you never know. The patient you're caring for right now could be the owner of a company you want to go work at later on in life, to where if they have a bad experience with you, and luck, coincidence, karma, whatever you want to call it, they're in charge of if you get hired or not, and they just remember that one bad experience that could cost you your job. To where if you're patient-centered care, you care about the patient, you put them first and make sure they're comfortable and make sure they're having, I guess, a good time. It can help open doors later on in life too.
Yeah, I think it's talking from one of my surgeries again. I know I told you this earlier. Like I woke up from a surgery one time and I was literally like crying, just a hot like mess after surgery. And the lady was just like so like compassionate, like, oh, like, are you feeling okay? And I'm like, because not everybody's like that, so it's just like, wow, like this person actually cares. Like they're here. Like she was literally wiping my tears off my face. Like how many other people are you gonna see? Like, and I think like seeing that, like it makes me like I want to make people feel like that. Like oh hey, they care that I'm getting better. Like they care that I can stay on this ball and balance. You know what I mean? Like I think that's super.
And then that, and then going off of kind of what I said about who you never know who it is. Yeah. Along with if you have a patient and you show them you care and they have a good time and they really like you, they may have a friend who has a back problem and they're talking to him one day and they'll be like, oh, you should go to this person. He's really good. He knows what he's doing.
It's going to help you out down the road.
To where if you just go through your clients day after day and you don't do anything specific and they don't see your drive and your passion to be there, you're not going to get anybody to recommend you to other people. And that could hurt your business, hurt your clinic, hurt a number of things.
I strongly believe that athletic training is all about connections and so like knowing certain ATs from different schools, or knowing like you like all the ATs, they all know like other people, and so like just being professional and being nice and considerate of other people, I think can get you really far in this field. So I think the opportunity is making those connections, and those connections can get you the places that you've always wanted to be.
Yeah, and I think like if we focus on like this stuff more now, like when we go to like apply to like jobs or like places, like we're gonna have like the people from here, they're gonna be like, oh wow, like I've seen how this person like works with like athletes and like clients and stuff, and they're gonna be like you really want this person, like they're good at this, like people are gonna like notice that.
Personal experience with that, applying for both these internships with the two baseball programs. building this good relationship and showing that I'm professional, but I also care about the athletes I'm working with, helps my preceptors see this, and they have a good idea and know that I'm not just here to be here. I'm here to do work, have a good time, and it also shows that I'm passionate about this, and I care about my athletes to where I apply for these internships. I believe I can get a great recommendation from past preceptors here to where a good recommendation can get you a long ways.
Yeah.
Those opportunities also can like reflect back on the school too. So
Yeah.
that since you got those, or like we have people working in high up positions, that looks really good for Manchester, and that just makes people want to come here more, and it makes you just get that experience that we should all get in the field.
I strongly agree with that too.
Yeah. Okay, we're rolling through these questions. Has athletic training been doing this? I think yeah, like everybody does this. I mean, I think it's obviously something everybody can work on, but I think like us being athletic trainers, like in the sports every day, like we have more of a connection with the athletes than like say like our surgeon does. Like he has like relationships with some athletes, but they're not gonna call him at midnight like, hey, like my knee hurts, like what do you think it is? Like, so I think athletic training, like I think it's a little bit ahead of the game, because like we have those like strong like connections with the athletes. I
believe that too, because we see the athletes every day. We work with them every day. We're always there, to where outside of athletic training, you take a general practitioner. They may see patient X 2 times a year, maybe 2 times every 5 years. You never know, and then they don't necessarily get to build a stronger relationship because they don't see them as much, to where, like I said, we see the athletes every day, to where that helps build the relationship, and they get to see you there every day and see how you work. So if you're slacking off and not doing a great job, and you're just there to be there and get your paycheck and leave, they notice that and they realize it, and then they start getting their own thoughts about you, and you might have little Johnny get a ankle sprain, and he doesn't want to come to you because he doesn't think you care enough to work with him, to where if you're out there every day and you show passion and you care, little Johnny won't hesitate and won't even think twice to come to you and be like, hey, I tweaked my ankle, what can I do, how bad is it?
I think we partly do this. I think that we are really strong with our athletes, but then there's points where we focus on like the best player, or we focus on like certain people that like if I had a friend in AT, or like we focus on them because they're like we're closer to them, or they need a pitch in the next game, So I think what we need to do is focus on everybody equally the same, because if we focus on those people that don't get much attention, they're really going to come back to us and refer us more than other people would,
And see, I've had personal experience with that too. Back in high school, I worked with basketball team with my high school athletic trainer, and we would have Johnny roll his ankle, and the athletic trainer would go to the coach and be like, well, is he a starter? Does he need to play? Does he have to play in this next game? And if yes, they accelerate to rehab. They try to get him back as quick as possible, to where if it's your third string point guard, so to speak, you can take that little bit extra time to make sure he's fully able and completely ready to go back.
And I know sometimes we can't do that because we're only one person, but at the same time we should like split our time up almost evenly, because it's not fair for those people, because they're going to think, oh, well, they don't care about me because I'm not the best.
I'm not star player, I'm not starting varsity, I'm not the go-to guy. I might not get the same treatment as he would.
I think, because right now we have a girl on the basketball team. She had an injury, and then she's like, well, I sit the bench, like it's not a big deal if I get back right away. But now, so it's hard to get her like into like rehab, so we had to be like, oh, like look at this, like you need to, like we had to like really get behind her and like do this. But now she's like, I'm 1 game away from getting a varsity letter, so like it's kind of flipped, like I need to do this, this, and this, like I need to play this game this week. and we're like, hey, you gotta kind of slow down a little bit.
Mm-hmm.
So like I think that's a good point about like we focus on some and not the others, but I think that comes back to the patients again, like if they're gonna try or if they're not gonna try.
Because you motivated her
Yeah.
that she could possibly get something
Right.
that she's gonna need
Yeah.
and she's gonna always not regret to do.
Yeah.
Like
Yeah.
that just goes back to patient-centered care and how we need to motivate our athletes as well.
Yeah. This is kind of like just not random, but going back, like I see one of my doctors like once a year, and like I look forward to it every year just because like my doctor, like I've been seeing him since I was like 16, and like I go back every year. He's like, oh, well, you're in school. Like, what are you doing? Like how's like this? How's your mom? How's your brother? Like the receptionist people, you're like, hey, like how have you been? Like haven't seen you in a while. Like I don't like. It's not like you get. I don't know how to like. It's not like you dread, like, oh, I have to go to this doctor's appointment, I have to drive to Indianapolis, like, I have to do this. You're like, oh, I get to see these people again. Like, I think that's so cool that you have a connection like that. I see this guy once a year, and he knows that I go to Manchester. He knows that I'm an athletic training major. Like, he knows all this. Like, he cares. Like,
and when he gets excited when you walk in the room,
like how many other patients does he see in a year?
Mm-hmm.
And like, he knows where I go to school. He knows like I do. I think that's super cool to like see out of a doctor.
And see, like, I get that, especially with my dentist and my doctor. I mean, partially because they're related to me, so they're more invested in me, I guess. But while I'm there, it's not just me. I see them do that with all their patients. Like, because when you go to the eye doctor, you go through your preliminary stuff, then they leave and work on somebody else, and they come back and finish up your eye exam. Well, I can hear him talking to his other patients, and he's just as excited and just as passionate to work with them as he is with me. And I mean, it sucks when you're at the dentist because they're trying to talk to you with their hands in your mouth. You can't really say much, and somehow they understand you. But every time I go to the dentist, they always ask me, "Oh, how's school going? Are you still doing this? Are you still in this major? Are you still going on with this part of your life?" And I mean, it makes the appointment easier too. You're not just like, man, now I gotta sit here through this cleaning and spend half an hour of my time bored, just recline and just having people digging in my mouth to where, oh, they actually care. They want to know how I'm doing.
And the word that you said that struck me was the passionate. I think that's another important thing of patient-centered care too as well, because if we don't have passion for our job or getting them better, then that's just, it's just not going to work. But
I think, like, kind of from, like, a patient perspective, like, what if you have a patient, like, because I, like, seen this with a couple athletes, like, they're in, like, a slump. You know, you have those athletes that are just, like, not even, like, in their sport, but just in their life. They're like, I don't want to do anything. I don't want to go to class. Like, I don't do this. And you're like, you care about them. And then all of a sudden, like, you change, like, how they are. Like, how cool is that to see, like, a change in somebody, like...
It's that stereotypical, you never know how far a smile will go.
Yeah.
Some of them be having the worst day of their life, and you just give them a smile and everything changes.
Yeah.
I mean, you hear stories kind of a lot where...
It's like that one.
This guy is contemplating killing his life. He went out and bought everything. He was going to do it that night, but one guy stopped and said hi to him, smiled, had a 5-minute conversation, and he ended up not going through with it, and he changed his life around. He's having a good time now. I mean,
it makes me
you never know how far kindness can go.
Think of that, like, Jimmy Dean commercial when he ate, like, the breakfast sandwich and he, like, gave the girl his umbrella. And the bus driver, and then, like, he smiled at somebody and then they give him, like, it's just, that's a really lame
example. With the athletes, too, like, I mean, some of them just got out of an injury that ended their career, like their season, their career, and so like for them to like come in like so depressed and stuff is something that we have to be there for, because it's not just the athletic side, the injury side, it's the psychological side, which is something I want to go into for grad school is sports psychology, because I think that part is like really cool. I like to motivate people. I like to talk to them like one-on-one, so I think that's a really important thing with injuries.
We don't want to break these up because that's at 20 minutes.
Come out.